What are health disparities in accessible health care? Imagine trying to get the health care you need but facing obstacles every step of the way. That's what health disparities in accessible health care are all about. They are the differences in how easily different groups can get timely, affordable, and suitable health services. These differences happen because of social, economic, and structural factors that create barriers. When some groups face more obstacles than others, it can lead to worse health outcomes for them. Accessible health care means that everyone can get the care they need without barriers like high costs, long distances, language issues, or discrimination. But in reality, some groups find it harder to access this care. For example, certain racial and ethnic groups like Hispanic, Black, American Indian, and Alaska Native populations often have more trouble finding providers, getting insurance, or affording care. People with disabilities also face unique challenges, such as inaccessible clinics or equipment. Insurance coverage is a big part of the problem. If someone does not have health insurance or relies on public programs, they might skip preventive visits or delay treatment. Out-of-pocket costs can make it hard for low-income and minority groups to get care when they need it. Geographic barriers also play a role. People living in rural areas often find fewer healthcare providers nearby, and traveling long distances can be difficult and expensive. Communication barriers are another issue. Limited English skills or low health literacy can prevent people from understanding health information or talking effectively with providers. For people with disabilities, physical barriers like inaccessible examination rooms or medical equipment can stop them from getting proper care. Attitudinal barriers, like provider bias or lack of disability training, also reduce the quality of care they receive. These disparities lead to poorer health for affected groups. They may experience higher rates of chronic diseases, lower life expectancy, and more preventable hospital visits. To improve this, healthcare systems need to be designed with inclusivity in mind. This means providing accessible facilities, training providers in disability competence, and offering services that meet diverse needs. Ensuring insurance coverage and affordability is also key. Transportation and support services can help more people reach healthcare facilities. Promoting health equity principles means recognizing the social factors that influence health and working to remove barriers. For people with disabilities, this involves creating environments that are physically accessible, culturally sensitive, and tailored to individual needs. This includes providing accessible medical equipment, training staff in disability care, and offering services that accommodate sensory or cognitive differences. Addressing health disparities in accessible health care is about making sure everyone has a fair chance to be healthy. It requires ongoing effort to build inclusive, affordable, and respectful healthcare systems. When we do this, we move closer to a future where health equity is a reality for all, regardless of background or ability.